Mental health encompasses our emotional, psychological, as well as our social well-being. It affects how we think, how we feel, and also down to how we behave. In recent years, mental health is getting more and more talked about and being heavily discussed. However, more often than not, people interpret and perceive mental illness as being in a state of madness or insanity rather than a malady. The truth is, dealing with a mental illness and dealing with a physical illness are much more alike than we think. Despite common belief, there are ways to go about mental health problems, just like how we do when there's a disruption in our body function. My name is Nabila. I'm a second-year MBBS student from UMed, and I'm humbled to be your host for today. And to discuss this topic further with us, today we are joined by two wonderful guest speakers. Firstly, I'd like to welcome Ms. Anum Sofia, a clinical psychologist from ThriveWell. So, Ms. Anum, would you like to say hi?
Hi everyone. Hi for everyone's listening. My name is Anum Sofia. So I'm a clinical psychologist working with ThriveWell. I'm also a clinical coordinator working for the clinical practice team.
So next we have Dr. Haslina Yusuf, a psychiatrist and also a deputy director of medical from Hospital Permai JP.
So hi everyone, I'm Dr. Haslina. I'm a psychiatrist. I've been working with Ministry of Health for the last 23 years. I've been a psychiatrist for the last 15 years. I've been working in Permai since 2001. That's a long time. I'm also a deputy medical director in Hospital Permai. So basically that's who I am.
As we know, mental health is getting a lot of attention and it's being addressed more now. And with the discussion of mental health comes mental health promotion and how important it is to talk about mental health. But actually, in the first place, why do people feel uncomfortable talking about it? And why is it such a difficult topic for people to open up about? So, Ms. Anum, why don't we start with you?
You know, when we talk about that feeling of uncomfortableness when talking about mental health, we always talk about stigma. Right? And stigma is basically, when in classical terms, when we talk about stigma, it's like someone who bears the stigma is basically someone who is disgraced or dishonored. So it carries with it a negative connotation with it. So when we talk about mental health, it means that someone who have mental illness, for example, they're seen as someone who is dishonored or disgraced. So this negative connotation really makes people afraid to talk about it. And when we stop talking about it, there's less of a discussion around it. And when there's less discussion around it, there's all this misconception that were never addressed. This is what causes people to be afraid of speaking up about mental health.
I think it's very much to do with our culture, Eastern culture. What I noticed is that we don't really encourage or we don't have avenue to talk about emotion. It's not often. Now, how often do you actually talk to your family or friends about your emotion? It's very striking when I ask my patient, usually when I ask, how do you feel? They are lost for words. They don't know how to describe their feelings. They will just answer things like, okay. I think it's also, the other thing is that it's got to do with our lack of understanding of what mental illness is. What I see when we talk, when I speak to Malay patients, they would say, Doktor, saya ni lemah semangat ke? These patients are patients who have depressive symptoms, saya lemah semangat ke? So that means that they don't really know that actually what they have is an illness, which is depression. They've never been introduced that idea all this while, not until lately, where more and more information are shared. You get more information now about what mental illness is about. The other thing is I think it's difficult also for people to talk, because when you talk about mental illness, it's very much associated with extreme emotion. So when you have this extreme emotion, when you want to talk, you are quite guarded. You are quite careful to talk about it, because when you have extreme emotion like sadness, anger, frustration. When you start talking, then you start crying. And of course, you feel embarrassed, isn't it? So that's why you avoid talking about it. So these are my thoughts about why people don't open up quite easily about mental illness.
We've talked about how Miss Anu mentioned that mental health is relatively a new thing, especially in our culture today. But since you've been practicing as a psychiatrist for many years now, right? So how actually has the views surrounding mental health in our society changed from when you first started practicing compared to now?
If you compare last time to now, what I noticed is that nowadays people are more comfortable talking about mental health issues. It's so easy for you to use social media. There's many avenues, right? YouTube, you can just post your view on YouTube and Facebook. So, and a lot of people are coming out, disclosing that they have mental illness. So I think I see that change there. People are more comfortable talking about it. I think awareness is more compared to last time. So there are positive changes that I see, but still there are still among the society who are still they don't I don't really know, is it that they don't understand or they refuse to accept the explanation, because of their how they've been raised, but I see improvement in understanding and acceptance, and their willingness to talk about mental health issues.
I was wondering actually, how common is it in your day-to-day work for people to associate madness or insanity with mental health problems?
I think that question is, it requires a little bit of explanation, because when you say that mental illness is equated to madness, it's not as much of that anymore. So for example, when we talk about mental illness, the certain mental representation that we have of it is perhaps madness. When we talk about a few years ago, when we talk about mental illness, what we have in our mind is insanity, people who have some kind of very serious illness like schizophrenia or bipolar disorder. So these kind of mental images comes because this is what we as a whole is thought to think about it. But now I think that when I talk to my clients about mental health, what comes into their mind is more of depression and anxiety. So the mental image already changed. Right? So this is what I think we're moving towards, and this is what I think Dr. Hastina said, it's kind of a progression from where we are. It's evolving, right? What we understand about it, the more we see, the more we talk about it. So this is what is important. It's changing in, I think in a good direction, but still the literacy isn't there, right? So a lot of people don't really understand what depression or anxiety is and kind of simplify it. So it is negative in its own way, but it is progressing.
I think one way to overcome stigma is just to talk about it. When you talk about it, the more you talk about it, and then the more people will understand what it is. And then that's how, when a person understands, when more and more people understand what mental illness is, then that's how to erode the stigma. What leads to stigma is actually not understanding it. So the other day, which brings to what I blame a lot too, is the media, especially television. They still portray the bad side of mental illness, without giving much information about the mental illness itself. Say if they have a character who has schizophrenia, they will portray this person having this psychotic episode, full-blown florid psychotic episode, but they don't add that explanation part of it, the educational part of it. So I think that needs to be improved.
Miss Anum, in your line of work, what do you think is the major factor that affects a person's mental health, the biggest one?
Okay, so the way I think about it, and also, through my experience, the thing is, right, when you ask people, is it from within or from the outside, you're going to get different answers based on who you ask. So it's not, oh, whether or not this causes this causes it. There's always an interaction, but whether or not that interaction is big enough, it's going to be different on who you ask. Like, for example, for me as a clinical psychologist, I've always, talked about, environment would be more important because that is what we can change, right? In an environment. But if we talk about, people who are biologists, or they would have different thoughts about this. So for me, I think what we can focus more is on, okay, so if this is the case, what we can do about it, instead of thinking, debating on the things that whether or not is the case.
What about you, Dr. Asmira? Do you have patients coming to you like, I need to get rid of these symptoms now, help me?
Everybody wants quick solution, isn't it? But then the answer is no, I'm sorry, I don't have quick solution. If I have one, I would like to offer, but we don't. Reality is we don't have it. One, because Anu mentioned just now, we don't have a biological identifier or indicator to say that you have depression or as such. We cannot isolate one reason or one biological factor which leads to depression or schizophrenia or bipolar. What we do now is that we give symptomatic treatment. For example, if a person has depression, we treat the depressive symptom by giving antidepressant. If a person has a psychotic symptom, we treat the psychotic symptoms such as hallucination and delusion by giving antipsychotic. And then we couple that with psychosocial intervention, such like what Anu has mentioned, therapy. There are various therapy, right? Like cognitive behavioral therapy, which actually focus on the cognitive aspect, how a person thinks, and try to modify how they think. And there are many more other therapies as well.